Hey everybody, this is Dr. Smith from Accomplished Health and Wellness, and this is my best friend Sarah.
Hi.
And this is tea time. It's a 10-minute little episode. We're not drinking tea right now. We're drinking water.
Hydration.
Anyways,
You should drink it.
yeah, probably. Lots of water right now. It's actually a good thing to drink when we talk about the topic we're going to talk about. So we are going to talk about urinary tract infections.
Yay, fun.
Yeah, so
Yes.
Sarah had a few questions, so we're going to let her start and then we're going to answer.
So I have a 2-year-old little girl, and the other day she was going to the bathroom a lot, out of the blue. Like she's potty trained, she knows what she's doing, but for some reason she was having to go quite frequently, and it spiked a very low-grade fever, not quite 100 degrees, right before bedtime, and then I put her in a diaper that night, and she ended up with a full diaper in the morning, which has been uncommon for the last several months. I was glad I put her in a diaper. So UTI came to mind, and I thought I would get your input. What do you think about UTI? Was maybe that what she was dealing with, or you have something else?
Definitely could have been a UTI. So we always think about when we think about urinary tract infections, the symptoms that we think about are always burning when you pee, going more frequently, having the urge to go more frequently, voiding small amounts, back pain, and low-grade fever, and then an upset stomach and throwing up. So those symptoms more are like ages 13 to like 55 or 60. And those are classic symptoms. The concerning symptoms are going to be in this age group: back pain, fever, and then upset stomach and throwing up, because oftentimes that means you could have a kidney infection instead of just a urinary tract infection. And it's easy to go from the bladder straight up into your kidneys. So in kids, oftentimes they won't always say that it hurts when they pee or burns when they pee.
And that's where I was confused, because she wasn't saying anything. She wasn't acting like she was in pain. She was still going to the bathroom willingly.
Yep, and a lot of times they will, up until about like 10 to 12, they oftentimes won't necessarily say it hurts when they pee. And so what they oftentimes will do is all of a sudden they will be wetting the bed, or they'll have accidents, or they'll go more frequently. And then the bigger thing that you want to look at with little kids, if you're worried about that, is an odor. They oftentimes will have an odor in their urine. It's kind of a pungent smell.
I did notice that a couple of days before that, so that very well could have been what it was.
Yeah, and I do see urinary tract infections in kids, and a lot of times it's because they just, especially in potty training ages, they just aren't wiping right.
Right.
As you get older, you learn how to wipe, not like back to front, but you're like, why you should be wiping front to back or middle to front, middle to back. But when they don't know that, or sometimes they'll wipe their butt and then their front, and it's like, oh, that's gross. So, anyways, definitely sets you up for urinary tract infection. So definitely should be something on your radar. The other thing is that you can look at the color of their urine. Sometimes it'll be like a cloudy, or it might be even an orangey color, and that would be concerning. Do they have blood in their urine? Because that is another symptom. We see that more in the like 12, 13-year-olds up to 55, 60-year-olds. We'll see that blood in the urine, but even so, we don't see that a lot. And then the older, like 55 and older, their symptoms are even different. They actually will oftentimes have the incontinence
Mm-hmm.
or leak the urine like the young kids will. They usually don't have any pain, and they oftentimes will be a little bit confused. So it's it's definitely a different type of symptom presentation in the older population.
So with young kids, for instance, my 2-year-old is here today. Is there a treatment that I should plan out for her, or will it resolve on its own? What sort of treatment should I look for her?
A lot of times in kids it'll be transient and they'll clear on their own, but sometimes they do have to be treated. And so, if they are complaining of any burning when they pee, or the frequency is happening and it's more than like 2 days, then that would be a good time to get a urinalysis, which they just pee in a cup for you and we look at it to see if it has any evidence of urinary tract infection. And so if we do see that, then in all age groups, it would be an antibiotic. And we just choose a different antibiotic for different ages. But things that you can do to kind of help clean out the urine, to kind of help see if it'll clear on its own. Here comes our little Amelia. She's watching Pete's Dragon. Oh, we got a commercial. Nobody likes commercials. It's Pete's Dragon. I mean, come on. All right. So things that you can do to kind of help clear out the urine would be number one, cranberry. Anything cranberry. So
would water help?
Water. Yeah. Lots of water. Then they're going to go more frequently. The clearer your urine, the better. So I always tell people, drink water. And at the end of the day, your urine should look like water. That means you drank enough. But definitely increase the fluids, because the more fluids that you have going through you, the more you're going to pee. The more you're going to pee, the more bacteria you're going to get rid of. Yep. The other thing would be cranberries. Anything with cranberries. So you could do like dried cranberries, cranberry juice.
But should you do the cocktail?
Cranberry
I've heard that
sauce.
cranberry juice cocktail is not.
You have to have, so it has to be like real cranberry juice.
So not concentrate or.
Right. It has to be like 100% cranberry juice.
So again, not like
juicy juice.
Right. Not the stuff that you go and get out of the kids aisle that has.
No. It has to like taste like cranberry and make you go.
Make you pucker?
Yeah. And then you can do cranberry sauce even. You can also, even if you don't like cranberries, you can get cranberry tablets in the vitamin section.
Easy way out.
Yeah. So there is definitely something to the cranberry. There's some studies out there that show that cranberries have something in them that actually binds the lining of the bladder, and it doesn't allow the bacteria to bind. And so when you urinate, you actually are urinating out more bacteria, and then the lining of the bladder is actually coated, and so they can't even bind there. So it just helps you to flush the bacteria out. So definitely something over the counter that you can do.
So it's like putting no stick spray on your bladder.
Yeah, it is. Heck yeah.
No stick spray.
No stick cranberry. So remember. So then the other thing, like if you're having some discomfort and you want to see if you can clear it with cranberry and extra water, would be Azo Over-The-Counter. Azo Over-The-Counter is the same thing as Pyridium. And it's basically just kind of numbs the bladder, or not even the bladder, actually, it's the urethra, so that when you're urinating, it doesn't burn. So you can't really use it in kids, but 12 and up, you can use it, and you just buy it over the counter. It's Azo. I think there's also one called Uristat, and then Azo has a bunch of different, like, max strength, and I don't know, a bunch of different ones. Anyways, so you can take those 3 times a day for 2 days, and that's all. And then you have to stop. And if you haven't cleared it by then anyway, you probably need to see your regular doctor so someone can take a look at your urine and see what's going on. But Azo also will change your urine colors. Like I always tell everyone, it's going to be either Kool-Aid orange or Kool-Aid red. So don't freak out. That's the Azo. Yeah, because it's really quite frightening when you look in the toilet and it's like now all of a sudden I'm bleeding to death from my urinary tract infection. But it's really the Azo. So those are the things like over the counter that you can use, and then the water. But then if it's not clear on its own, definitely you'd want to do an antibiotic.
Okay. So far she's had hers. As we're sitting here talking, I'm thinking back on symptoms and things that I might have missed before telling you this story. And I'm guessing that she's had hers for probably 3 days, but I think that it's actually cleared. I think that what the fever was, I think that was like the end of it, and everything had kind of flushed out because we haven't had any issues since then. So yay, maybe it's done. Woo-hoo.
Yeah. Woo.
So we've talked about treatment. We've talked about treatment for kids. We've talked about treatment in general for adults. We've talked about over-the-counter and foods. We know that cranberry is like a miracle medicine for
the
bladder. So let's backtrack a little bit and talk about the causes. How did we get to the point where we needed to seek treatment? So what for a 2-year-old, I guess we kind of covered that, and wiping, especially with potty training, they're learning how to wipe appropriately.
Right. And then also like in toddlers, if they're still wearing diapers and they get diarrhea or anything like that, then that can get into the urethra too.
Those nasty diapers, it mashes it all up.
Yeah. Makes your trash can stink. Anyways, for youth, it's really actually, in the kid, they really have to be wiping correctly. And so if they're not wiping correctly, they can get it. But oftentimes also in youth, what we'll see that can cause irritation that may even look like a urinary tract infection is bubble baths. Bubble baths are bad.
I didn't know that.
Yeah, they cause a lot of like irritation in the urethra and also the vagina. So it's just irritated.
Can you do it for boys too?
Not as often with boys as we see with girls. Girls, if they're really complaining of burning when they pee, it's off, and they take bubble baths. It's the bubble bath.
Interesting.
Yeah.
Who knew? Bubble baths.
Right?
Kids love them.
I know.
They're bad for them.
Their urethra does not like it. No. In youth, it'll be that they're starting to actually hold things more. They're holding their bladder longer, so they're not going more. So the bladder is a great place to grow bacteria. They just love it. It's a warm, moist place, and urine is a great thing. It's a great media to grow. And so they might be holding it longer. They might not be wiping right. They might be doing things they're not supposed to be.
But we won't go there yet.
Like sex.
Not my baby.
She's only 2, so that's not good. She doesn't. But your teenager might. And then older people, so in our age group, a lot of times I see it after a weekend getaway with the spouse or the new
weekend getaway, whatever would you be talking about?
Or the new lover. Because there's a lot of sex that happens. And sex is not clean. The vagina isn't clean unless you clean the penis. It's not clean. And
what if you do a weekend getaway where you spend all of your time in the shower or in the
You're
pool?
Still having sex.
But
you shouldn't have sex in the pool. Other people are in there. This is a family pool, not a family making pool.
Maybe not one of those pools.
Just kidding. So, anyways, intercourse is not clean. ever because the vagina is a war zone. There's like bacteria and yeast in there. They war for territory. They keep you down in check.
And they have their battle wounds.
They do.
Their battle scars.
And you know, the penis, it goes in and then it drags everything out with it. And
a scoop.
It is. It's like a scooper. And it scoops it out and then pushes it in and scoops out. Anyways,
it's a mixture.
That stuff goes into the urethra and then it climbs into the bladder because it's a great place to grow. And so we see that a lot after weekend getaways. And so urinating after intercourse is actually helpful. Making sure that you're wiping properly. And then don't hold it. Like, we think that we should hold it forever.
So I consider myself to have a big bladder because I don't go to the bathroom
You've
very
never
often.
had a big bladder until you had you were in a surgery for like 4 hours and you're sitting there going, man, where's the leg bag? I need the leg bag right now. Anyways.
Yeah, I don't go to the bathroom very often, but I also don't get very many UTIs, thankfully.
So your bladder grows and grows and grows, but, well, stretches. It doesn't grow. It doesn't actually grow, but it stretches. It accommodates the urine. But that can put you at an increased risk when you get older.
I'm not getting older.
No, we don't get old.
We don't get older.
So as you get older, your bladder isn't, it gets all stretchy. And then it doesn't always empty all the way. And so it sits in there. And then that's what puts you at an increased risk when you're older. But then also, you've been your whole life not going to the bathroom, but every 4 or 6 hours. And so you still don't do that. And so then there you are. Urinary tract infection. Yep. So anyways.
Note to self.
It's actually, it's good to go like every 2 hours. Even if you don't have to go, there's always something in there. I tell my daughter that all the time. Just let out whatever's in there because there's something in there. Just let out. But it's good.
Drink more water so that you have to go more often.
Right. Mm-hmm. So, because your urine needs to be clear by the end of the day. But here's the thing. When you get up to go, you're actually getting up to do something. And that's exercise. So
I have a desk job. I need to get up more often.
Yeah. So you're like doing a bunch of things. So number one, you are getting up and exercising. You're emptying your bladder. And you're decreasing your risk of a blood clot.
And you're getting more water for hydration.
Hydration. So I'm saying that if you want to fight off all of this stuff and you don't want to do it, and you don't want to get them, then drink more water, go to the bathroom more, and get some exercise.
That sounds like a plan.
Yeah.
I could probably handle that.
So thank you for joining us on this Saturday for tea time. We're talking about urinary tract infection. So if you have any questions at all, please don't hesitate to ask. I know that we went over a little bit today. We'll try and keep it shorter next time. But thanks for joining us anyway. Have a good day. Thanks. Bye. If you end this video, no,